our Armamentarium, we have the needle holder, surgical scissors over there, and then we have forceps. So me, I have 2 forceps. Material is silk. It is the most commonly used in the field of dentistry. So with the figure of 8, we have a pattern that goes 1, 2, 3, 4, and then we go back to 1. That's where you put your knot at the buccal side, it's at the buccal side, so that you can remove it easily. You can see the knot from the clinical view. What are the indications for a figure of 8? So the indication is you are closing a socket. So if it's only a 1 tooth extraction, figure of 8 is very good, and it is used for the adaptation of the gingival papilla around the tooth. Okay, and for bone graft placement, you use it for bone graft placement. That is the suture technique you use. Advantages and disadvantages. So the advantage is it gives you a rapid closure. It closes very quick. And then the disadvantage is that due to its orientation, it's quite difficult to remove, such that it leaves a significant amount of suture threads inside. It leaves suture threads inside. Interrupted sutures. How do you do the suture? So you do the pass technique. And then 2 loops around the needle holder. Then grab the tail and do the knot. Okay, so we do the surgeon's knot. You do 3 clockwise, 2 counterclockwise, 1 clockwise. Indications is for single tooth extraction and 3rd molar extraction flap. It's also for biopsies, and it's also for implants and more. So it's the most commonly used suture technique in dentistry. Also, it is preferred in urgent situations. It's the easiest suture to do, and also it is very easy to remove. It's very nice. It's very easy to remove. This one with the advantages. Then the disadvantage, of course, we have disadvantages. So the disadvantages would be it does not bring all surfaces into contact, and it is less supportive of healing of the flap margins. So it does not bring the flap to complete healing. Okay. So now you are doing the simple continuous suture. So with the simple continuous suture, you start off with an interrupted suture, then you cut the tail off, then you leave that last piece loose, then you can do your loops. So what I like to do is with the last, when I am about to finish, I loop it again, and then I leave the last one very loose. I don't pull it, it's just loose, and then that's where I do my knot right there. Yes, that's how I close. Okay, so its indications is for bone graft removal of mandibular tori, tuberosity reduction, and where aesthetics are not really that important. Okay. And then its advantages is it is very easy to produce a more watertight closure. Okay, but then its disadvantage is that if you cut a part of it, you will lose everything. So, and this one is the vertical mattress suture. So, the vertical mattress suture is the far, far, near, near technique. So, as you can see, I'm doing from buccal to lingual, far, and then lingual to buccal, near, near. Okay, and then I do my knot already. It's nice. And its indications where the wound edges will tend to evert. Evert means inside out. Okay. It gives greater closure strength. Yes, and it has a good distribution of wound tension. Yes, and then its disadvantage is scar formation and the formation of edge necrosis. Yeah, it gives edge necrosis. Okay. Next one is the horizontal mattress suture. So the horizontal mattress suture is the strongest type of suture. It's very far away, like 8 millimeters from the edge. So why do I say it's far away? So it's indicated for large in distances between tissues. Also, it's good for bone grafts, implants, and closure of extraction socket. So it's really nice, as you can see. Yeah, and then advantages is it's good for hemostasis and less prominent scarring. So it's good. Disadvantage is that it leaves a gap in the flap incisions, and it's quite difficult to remove, as you can see, because it's inside. You can only see it from the buckle, so you would most likely to leave some threads inside the socket. Okay. Due to daily surgical procedures of the dentist, a greater knowledge of surgical armamentarium and surgical suturing techniques is quite needed. The success of technique-sensitive surgeries is very quite dependent on the clinician's knowledge and skills. That is how you suture the figure of 8, the interrupted, the simple continuous interlocking, vertical mattress, and horizontal mattress. So that's already 6 suturing techniques, and I hope you enjoyed our how-to today. Okay, so that is all for today. This is Alexa Dimayuga of DFB, so I hope you enjoyed. Bye!